So today, let's talk about the risk factors which are involved in the development of breast cancer. This is a very frequently asked question, both in theory and in viva. So, uh, this diagram shows all the risk factors that are involved in the development of breast cancer. So let's go one by one. First, it is the gender. So, female female gender uh, has a higher chance, not just a higher chance, has a very significant higher risk for developing breast cancer than the male gender. Breast cancer cases occur only in 1% of males. 99% of cancers are in females only. Okay, so first is gender. Next, it's age. Increasing age. Breast cancer is very rare before 25 and very uncommon before the age of 30. Most of the breast cancer patients you will see, they will be above the age of 30. So the risk of developing breast cancer is directly proportional to the age. Then let's come to prolonged exposure to estrogens. This prolonged exposure to estrogens can be both endogenous or exogenous. Endogenous, early menarche, that is the starting of the menstrual cycle, the age at which the menstrual cycle occurs. The menarche, the starting of the menarche, if it is less than 12 years of age, or the menopause. If it's late, that is more than 55 years of age, the chances of getting breast cancer is significantly higher. Late age at first pregnancy. That also increases the risk for developing breast cancer. Nulliparity, that is having no children, also increases the risk of developing breast cancer. Postmenopausal obesity, it also increases the risk of breast cancer. Why? Because there is increased synthesis of estrogens in fat depots. Carcinoma of the contralateral breast or carcinoma of the endometrium, both of these can produce prolonged estrogenic stimulation. So these also can cause the breast cancer. Increases the risk for breast cancer. Exogenous postmenopausal hormonal replacement therapy increases the exposure to estrogens. So this was all about prolonged exposure to estrogens. Next, come to germline mutations. Mutations in tumor suppressor genes like BRCA1, 2, 1 or 2, or both. Then P10, TP53, germline mutations. The germline means from birth. Germline mutations in tumor suppressor genes increases the risk of developing breast cancer. Family history. This is very important. Family history. First degree relative with breast cancer. What do you mean by first degree relative? That is your mother, your sister, your daughter. They are your first degree relatives. So if they have a history of the breast cancer, the chances of your developing a breast cancer significantly increases. Next is geography, reproductive pattern and absence of breastfeeding. This is not reproductive patterns and absence of breastfeeding. Reproductive patterns means the number and timing of pregnancies, and the absence of breastfeeding. There's a relation. The longer the woman breastfeed, the greater the risk reduces. The longer the woman breastfeed, the greater the risk reduces. So there is an inverse relation. Next is environmental factors. Environmental factors include radiation to the chest due to cancer therapy, atomic bomb exposure or nuclear accidents increases the risk. Toxins, organochlorine, pesticides have estrogenic effects. Cigarette smoking, active smoking can increase the risk. High fat diet, alcohol consumption, physical activity. Physical activity is inversely proportional. If the number of hours of physical activity in a week is high, then the chances of chances of developing a breast cancer significantly decreases. But alcohol consumption is directly proportional. High fat diet is directly proportional. Cigarette smoking is directly proportional. Toxins directly proportional. Radiation directly proportional. Physical activity is inversely proportional. These things you have to remember. Which is directly proportional, which is inversely proportional. That's very common sense. Then benign breast disease. Benign breast disease means if previous breast biopsies had atypical hyperplasia, proliferative breast disease with atypia or lobular carcinoma in situ, they increase the risk. Atypical hyperplasia. Next is breast density. Women with very dense breasts. How do you know the breast is very dense? By the mammography. Have a 4 to 6 fold higher risk of developing breast cancer compared to women with lower density. So these are all the risk factors involved in development of breast cancer. Now, let's talk about some factors that reduce the risk of breast cancer. First is breastfeeding. I already talked about that. Long duration of breastfeeding has a protective effect. Physical exercise, inversely proportional. Healthy body weight, inversely proportional. And these factors like a high, there are while writing in the exam, you can you write it like the risk factors which are non-modifiable and the risk factors which are modifiable. Modifiable risk factors include the absence of breastfeeding, right? You can modify that. Exogenous hormone replacement therapy, you can avoid that. Post-menopausal obesity, you can reduce your weight. High dose radiation to the chest at a young age. Cigarette smoking, you can stop smoking. You can stop consuming alcohol. You can increase the number of hours in the gym. Like you can reduce eating a high-fat diet. But what are the non-modifiable factors? Like gender, you can't change your gender, right? Age, you will get older. Then non-modifiable early menarche, that's not upon you. Late menopause, that is also not upon you. Then pregnancy, it's you can't if, you can't comment on that. Pregnancy, it's modifiable or non-modifiable. That's upon the person. It's her decision, right? Germline mutations in tumor suppressor genes, you can't change that. Family history, that's not on you. Then personal history of breast cancer, like contralateral breast, if your contralateral breast is involved, that's not on you. If you have a higher density of breast, that is not upon you. You can't change that. Benign breast disease, you can't change that. So you can write like this.